This audiovisual will show you how to manage one of the common difficult situations you may face in the care of people with dementia, those who are agitated and aggressive. People with dementia act aggressively or behave in an agitated manner in response to little or no external stimuli. Having clients yelling, screaming and lashing out in non-confrontational situations may be a confronting experience for new staff. Jack is an inexperienced student nurse on his second day of practicum experience.
Good morning, Mrs. Green. Good morning.
Who are you?
I'm Jack. I'm a nurse who is going to help you this morning with...
What are you doing in my room? Please leave.
Well, actually I just started working here, like this is my second day. I'm a student of nursing and I was told by my supervisor...
But I always thought that
Yeah.
nurses were female ladies.
Yeah.
But you work here.
I work here, yeah. I'm actually a student of nursing and I was told by my supervisor that you have a wound on your leg that needs to be taken care of.
No.
And it's very necessary because
My
it's...
leg is all right. Please go away.
But can I please check it out because it's important that we need to treat your leg?
If you have to,
Yeah.
all right.
Yeah.
No.
Yeah.
Leave it alone. No.
Yeah, but Mrs. Green, it's really important that we're gonna treat your wound. It's...
Well,
Otherwise, the
It
situation...
feels quite all right. It
it's-
feels quite right. Please keep away from there. Please leave me alone.
Let me
Please
check-
don't.
let me
No, there's
check it
no
out.
need.
Yeah?
Go away, please.
Okay.
Help me, someone help me, please. I don't know what to do. Please.
Hi, Jack. Are you okay?
No, I'm not. Like,
What's down here? What's wrong?
this lady you just sent me to, like, she's crazy. Like, she just hit me.
So, do you feel you've been thrown in the deep end with Mrs. Green?
Of course, like, she is just completely off the wall. She's aggressive. Like, how can you send me to her? I'm just started working here.
Jack, it can be quite confronting when we actually witness behaviours like this, especially because you couldn't work out what was going on.
Yeah, but I don't think this is normal behavior. This is just completely... She's crazy.
No, she's not crazy. Why don't we go down and have a chat with Mrs. Green together and we can see if we can't handle this in another way.
Okay, I can give it a try.
The first thing that goes through my mind when I meet a client who is displaying behavioural difficulties is, this is not how I will define them. There may be an underlying unmet physical or emotional need that causes them to respond in this way. Having a quick look at a person's chart can give you an idea about what the issues may be. One common reason for aggression is the presence of urinary tract infections.
Hi, Mrs. Green. My name's Sarah. I'm one of the nurses. I love coming and spending time with you. How are you feeling today?
Not well, not bad.
Not bad. It's a little bit cold at the moment. Are you sleeping well at night?
Yes, I slept fine. I didn't feel the cold. I'm from Nottingham, you know.
Oh, that's right. You told me that you're from Nottingham.
Dementia patients are more than just what they are now. They are also the culmination of what they were. Mrs. Green spent 40 years teaching English in a high school, and on her good days she could beat both of us in Scrabble, even if we had a dictionary. What she is like now does not define her or the way that she will be remembered by the people who love her, so start by making them feel like they are important. Your physical safety is very important. You cannot take care of people if you are not safe. So if you are feeling unsafe or threatened, do not hesitate to leave. If you think a client may be aggressive, take time to evaluate the situation and the threat level. If it feels safe, engage them in conversation.
Very willing.
How's your leg feeling, Mrs. Green?
Well, it has been itchy today.
Do you mind if I have a look at it? We might be able to find out what the itching is being caused by. Might make you feel a bit better.
No, if you'd like to, it might make it feel better.
Okay. Do you mind if Jack has a look?
No.
Okay. Jack, just come through and have a look here. I'll just put some gloves on firstly.
I can pull this up if you like.
Oh, that would be great, Mrs. Green. Thanks for helping.
It is not always helpful to tell people how things are going to be with their care. When you ask people about how they are feeling and encourage them to ask for help, you are engaging them in their own care. Because Mrs. Green has told me that her leg is hurting and itchy, she is much more likely to be willing to allow me to remove the bandage and look at it. In fact, not only does she not resist, but she also provides me with the extra information about the itching that helps me to care for her better.
Oops, it's hiding there under your socks. Oh, that's looking a lot better.
Techniques that work once may not work the same the next time, because people living with dementia have good days and bad days, just like the rest of us. When caring for people with dementia, it is important to put effort into validating them and making sure that you know their concerns, like Mrs. Green's concerns for her itchy leg. Also, try to make sure that body language and non-verbal communication is calm, and that the way you're acting is not going to hinder the ability to build a trusting relationship. Just remember that these are people who have value. Dementia care is a specialty area of nursing. Why not investigate further to increase your knowledge?